I'm Branden Doyle, founder and CEO of Violett, and we've developed the CrowdStrike for pathogens. Credit to Ron for that tagline. And I'll be the next to struggle with the clicker. So air health is critical for all of our health, so why don't we think about it more often? Why isn't it top of mind? It's an invisible problem. Most solutions out there don't solve the whole problem, and a lot of them are too expensive to access. So I like to think about this like a bottle of water. So if I knew this bottle was full of bacteria in this water, I wouldn't drink it. If I knew that, I wouldn't drink it. With air, it's a similar thing. We can't hold our breath for very long. We don't really have the same option as water. But if we knew that the air was full of a specific virus, a bacteria, mold, pollen, we would be moved to solve that problem for the building, right? So what does CrowdStrike for pathogens mean? It's making air health look more like cybersecurity. So we've developed a technology that can constantly be monitoring for threats, identify specific threats, viruses, bacteria, mold, and essentially take action to resolve that threat, eliminate those threats, and also communicate immediately with all the stakeholders involved. So how does this work? The technology we've developed is essentially ionizing air, and when things in the air are ionized, they're going to emit light of a specific wavelength, and we can detect those wavelengths with fluorescence spectroscopy. So that's all technical stuff, but really what we're doing is we have a data set of known wavelengths that are associated with specific pollutants, so viruses, bacteria, mold. And when that wavelength shows up, that means that that particle is in that room, right? And we can report that, we can take action. And so we're using this to develop a platform that will be constantly searching for these pollutants in the air, notifying stakeholders when they're there, and taking action to keep people safe. We're going to be able to incorporate artificial intelligence into this platform. Really, that's going to be for predictive analysis and notifying before there's an actual problem, monitoring trends, and reporting. That doesn't solve the whole problem. If you know what's in the air but you can't remove it, you're only part of the way there, right? So we have also developed technology that's industry leader in eliminating viruses, bacteria. There's a version of this out in the other room you can take a look at. We have it as a portable device. We've also developed that into a built-in solution that can be installed in the ceiling. Long story short, we maximize UVC dose of an airstream going through a system, and we're proven to eliminate all pathogens. And a little bit heavy. Nice job. You've been working out, haven't you? So yeah, I mean, right here we have a high-intensity UVC chamber. We create a vortex airflow in that chamber. We've proven to eliminate all pollutants in the air that are going through this system through a lot of third-party testing. We have over 600 facility customers that are using our air disinfection technology, schools, elder care, healthcare, with a lot of great results. We have an experienced team. I've been working on this for a while, and I worked for Department of Defense for over a decade before this as a nuclear engineer and technology leader. There's a lot of companies that are focused on cleaning the air. There's nobody that can do real-time pathogen differentiation. This is first of its kind technology that we're launching. It's a large market, but this is only considering the US, and it's only considering healthcare, elder care, education. And in our target market, really we're focused in elder care primarily right now. So we have sold a lot of devices, but really as we move to pathogen sensing, it's going to be enterprise subscriptions for the data. And I will kind of breeze through these last slides here. We've sold over $2 million in revenue, and we have really strong IP protecting all of our technology. And then we're developing a large go-to-market partnership with Overcast Innovations, which is a McKinstry and Armstrong company that we're really excited about. And we're going to be currently raising a $1.5 million safe note with a $6 million post-money valuation and a 20% discount. We're going to use the Venture Mechanics hybrid safe. And yeah, that is all I have. Great. Ready for questions.
Sorry about the obnoxious timer. We need to get a new one.
That's all right.
Questions for Branden?
So does does it identify the actual viruses, just tell you that there's that type of organism and then you have to do an assay after that? Or are you collecting any particles for further testing? How are you managing that part of things?
Yeah, so essentially how this works is we create a data set of known pollutants. So if bird flu goes airborne, we isolate that, we test it, and we identify bird flu. We can identify RSV, COVID, all of those things very specifically. It's not like they have a different wavelength emitted. Yeah, so we've identified that influenza and COVID-19 virus, they're very similar in structure, but they emit a different wavelength of light when they're ionized. And so this is a full data set that's going to give you very specific information of what's in the air.
And then it's continuously monitoring as it's cleaning the air to tell you how much the concentration is coming down until it's zero.
Yep.
Can you talk a little bit about your business model and your margins?
Yeah, so up till now we've been selling devices, and we've had between 60 and 70% margin on what we've sold previously with this, and we're going to be moving towards a subscription model where it's going to be a monthly fee for facilities to go access the technology. But the hardware itself for pathogen sensing, it's going to be, as of right now, pricing around 50% margin for the device, but focus more on subscription revenue.
Any last questions? Outdoor voice, since you're not by the
I can repeat the question. Yeah, could it be used for screening people or diagnosis? That's a great question, and we're working with a university on this, University of Utah, and the professor that I'm working with developed a breathalyzer previously for Zika, and that's an implementation we're looking at. And how do you, somebody's coming in for a high-risk job, how do you make sure they're not bringing a virus into the workplace? That's a really important thing that we're going to work to solve.
So imagine at a ICU, NICU, oncology ward, you'd want people using the breathalyzer before they go anywhere near these patients. Yeah, airplanes, absolutely. You could signal to the cockpit that tuberculosis has been picked up, drop the oxygen masks. CDC will meet you at the gate, but we're cleaning the air in the meantime, but actually invoke a protocol. Because right now you can absolutely catch COVID from the person sitting right next to you, even though the HEPA filters, in theory, are catching all the viruses. The reality is he's right there, and it takes a while for the air to get to the HEPA filter where it's trapped, not destroyed. So that's a risk to the maintenance people who have to replace those filters. Any HEPA filter is just holding on to those pathogens, but it can actually be destroyed. So that would be an OEM licensing deal to Donaldson, PTI, Honeywell, companies that do those on aircraft.
Cool.
Super.
Thank you.
All right.